Quick note: this is an automated educational summary of public medical sources: Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. Gut health has become one of the biggest wellness topics, but most people don't actually know what's happening in their microbiome. That's where at-home gut health tests come in. These tests can now be ordered online and completed at home without a doctor's appointment. Today, we're covering exactly what you need to know: what these tests measure, real costs in 2026, how they actually work, and the honest limitations you should understand before ordering. According to the NIH, your gut microbiome contains trillions of bacteria that influence digestion, immunity, and overall health. At-home tests typically analyze stool samples to identify which bacteria are present. Medline Plus explains that tests measure bacterial diversity, dominant species, and sometimes markers related to digestion. Think of it as a snapshot of your gut's bacterial ecosystem, not a diagnosis, but educational data you can discuss with your healthcare provider. The results show bacterial percentages and diversity scores. There are several categories of at-home tests. Standard microbiome tests identify bacterial composition and diversity levels. Comprehensive tests add inflammation markers, digestive enzyme activity, and sometimes food sensitivity data. Some focus on specific concerns like bloating or energy. Mayo Clinic notes that test depth varies. More detailed tests provide broader data but cost more. Most use stool samples, though some newer tests also include saliva or blood components. Prices and what's included differ significantly, so knowing your options matters. At-home gut tests in 2026 typically range from about $150 to $500 depending on complexity. Basic microbiome tests start around $150 to $200. Mid-range comprehensive tests usually cost $250 to $350. Advanced tests with multiple biomarkers can exceed $400. Some companies offer subscriptions or bundled tests at discounts. Most insurance doesn't cover these since they're considered wellness screening rather than diagnostic testing. A few platforms integrate telehealth consultations for an additional $30 to $100 to discuss results with a practitioner. The process is straightforward. You visit the company's website, select your test, and place your order. Most kits arrive in 3 to 7 business days, with everything you need included. The package contains clear instructions, a sterile collection device, and prepaid return shipping. You complete sample collection at home. The instructions are very detailed. Most companies offer digital tracking, so you know when your sample arrives at the lab and when results are ready. Results typically arrive within 1 to 4 weeks depending on the provider. Sample collection is simple, but requires following instructions carefully. The Cleveland Clinic emphasizes that proper collection is critical for accurate results. You collect a small stool sample. Using the sterile tool provided, place it in the container with preservative solution and seal it securely. The preservative keeps the sample stable during shipping. Most companies provide video guides and customer support if you have questions. Improper collection can affect results, so don't skip the instructions. After sealing, you drop the prepaid envelope in any mailbox. When results arrive, you typically get a detailed report showing bacterial species identified, diversity scores, and percentages of different bacterial families. Mayo Clinic notes that higher bacterial diversity generally correlates with better gut health, though this isn't universal for all people. Your report flags specific bacteria as low, normal, or high, compared to reference ranges. Most platforms provide educational context, explaining what each finding means. However, and this is crucial, results aren't medical diagnoses. They're data points. Always discuss results with your healthcare provider before making changes. Here's what these tests cannot do. They cannot diagnose digestive disorders. infections, or diseases. They cannot replace professional medical care. Medline Plus emphasizes that one snapshot doesn't tell your whole story. Your microbiome changes weekly. If you have ongoing digestive symptoms, see a doctor first before ordering a test. These tools work best for generally healthy people curious about their microbiome. If results concern you or you have persistent symptoms, that's your signal to book an appointment with your primary care doctor or a gastroenterologist. What type of health tests are you interested in? Comment below and we will make a video about it.